Good morning, everyone. And today we are going to start a few more topics we will discuss in this lecture. The most important of that is, of course, anemia. And I will start talking about anemia from now. So, what is anemia? Anemia is basically whenever in the body, you can see a definition over here. Um, so, it's basically simply a decrease in the red blood cell count. Okay, and it's not the RBCs which makes the difference. It's the hemoglobin which is in the RBCs. So when the hemoglobin level in the or hemoglobin concentration in the body goes down, uh, it gives the sign and symptoms of anemia. So by definition, it's a decrease in red blood cells. Mass, of course, that can lead to hemoglobin concentration decrease or hematocrit decrease in the body. So, as I was discussing in my previous lecture, how we diagnose anemia in any patient is like we simply order a CBC, and when we order the CBC, so we get the results like what is the level of HB in the body, okay, and in the males, when the level of HB is less than 130 gram per liter, or in males, okay, and if, for example, less than 12 grams per liter in females, so we call this condition as anemia. So uh, in pregnancy, this is not the definition, but we have our discussion right now is not that one. Pregnancy, the levels are different. So um, simply whenever like there is anemia in the body, what we check is the MCV, and we classify anemias on the level on the basis of the MCV. Either it's less than 80 femtoliter, we call it as micro microcytic anemia. If it is between, you can say 80 to 100, we call it as normocytic, and if it is more than 100, we call it as macrocytic. Okay, so like this is how we classify anemia, and you can see over here. So simply whenever there is like microcytic, macrocytic, or normocytic anemia, we have to remember the causes. That's very important. So microcytic anemia can be remembered by simply remembering a mnemonic called as TAILS, TAILS, TAILS. I don't like this mnemonic because the most common cause of anemia generally as a whole is iron deficiency anemia, and so of course that should come on the top. So of course, like the most common cause of microcytic anemia is iron deficiency anemia in the world, and most common cause of anemia generally in this world is iron deficiency anemia. Of course, like in developing worlds, that is due to lack of calorie intake, especially in the kids, and in the developed country, most of the adult or old people, they get this iron deficiency anemia because of cancers or some chronic conditions. So tails, TAILS, okay. I don't like this mnemonic, as I told you, because in this one, T is for thalassemia, it comes on the top. I is for iron deficiency anemia, whereas A is for anemia of chronic disease, okay. And um, after that there is TAIL is for lead poisoning, okay, not so common these days, lead poisoning anemia. And S is for sideroblastic anemia. As I told you, like if you don't know what is sideroblast, you can go through the previous lecture and I explained what is sideroblast cells. So these are the five causes, you can say, completely remembered by the name tails. Okay. Whereas, like, whenever there is a normocytic anemia, generally speaking, whenever like there is normocytic anemia, we go for one more test. We check the reticulocytes count. Reticulocyte count. As I told you, reticulocytes are basically uh, the immature, okay, cells, RBCs. And why we check reticulocytes count? There could be two. Like we see, like either the body is making more RBCs or not. So simply there could be two conditions. Either there will be reticulocytosis or simply high reticulocyte count, which means that the body is making RBCs, more and more RBCs, and the other condition could be that the reticulocyte count would be low. Okay, reticulocyte count get below. So, which means like not enough RBCs are done. So, whenever like the normocytic anemia is there, we check MCV and it comes back as like between 80 to 100. We name it as normocytic anemia. Hemoglobin is less, anemia is there, size is between 80 to 100, so it is normocytic. So, we go for reticulocyte count. So, whenever the high reticulocyte count is there, so it means like the body is making more and more RBCs. So, there could be number of causes. For example, it could be due to bleeding or hemorrhage simply, like the patient is losing blood, and when the patient is losing blood, basically there is no abnormality with the machinery which is making the RBCs. So of course the body will keep on uh, giving more and more RBCs. So bleeding could be one of the cause, and the other causes can be, if there is hemolysis going on in the body, like the RBCs are getting destroyed, and of course when the RBCs are getting destroyed, so the body still have the machinery working, which is making more and more and more RBCs. Okay, so whenever there is hemolysis, again, hemolysis can be due to inherited causes as well as acquired causes, like sickle cell disease and spherocytic hereditary spherocytosis. Many conditions are there. Okay, in malaria, for example, the patients who have malaria infection, there could be hemolysis or breaking down of more and more RBCs. So anyhow, when we will discuss hemolytic anemia, I'm going to talk about this thing, the inherited uh, as well as what you can say acquired causes. Okay, of course, like when we are going to discuss this one in detail, we will go on that. So whenever like the low reticulocyte count is there, so of course it means like the body is not making uh, RBCs. So there could be okay. Whenever like this is the condition, like the body is not making RBCs, what we go is like we see the other cell lines. For example, if the body is not just making RBCs, the problem can be different. But if the body is not making RBCs, WBCs, or platelets, like all the cell lines are gone, so it means like there is some problem in the bone marrow, for example. So simply we check for either it's pancytopenia. Whenever there is pan word, guys, with in medicine, so it means like all. So pancytopenia, like all the cell lines are disturbed, okay, are gone, or either it will be non-pancytopenia. So simply pancytopenia, like of course, like this one point towards the pathology is in the uh, bone marrow. For example, one of the example of this one is aplastic anemia, in which the body is not making all the cell lines. Aplastic. Parvovirus B19 infection in kids or in adults, sometimes it can give aplastic anemia, like the bone marrow stop working, all the cells. In developing countries, TB, tuberculosis, sometimes it invade the bone marrow, and when it invade the bone marrow, what happens is the bone marrow is infiltrated by tuberculosis, mycobacterium tuberculosis, so it destroy that. And once it destroy that, what happens, like there is no more working bone marrow, and the body is not going to make more cells. So aplastic anemia, myelofibrosis, in which like the bone marrow is having fibrosis, and whenever there is fibrosis, of course the normal tissue is replaced by fibrous. So what happened is like it is not going to function properly. It is not going to produce more cells. Myelodysplastic syndromes, leukemias, and tuberculosis. I give you the example. There are many drugs, chemotherapeutic drugs. When we give, what happens is like all the cells lines are not formed. So these things can be there, and the other one is non-pancytopenia, in which just the RBCs are the one which are affected. Again, like one of the cause like of non-pancytopenic anemia is anemia of chronic disease. Renal problems as well as liver problems can lead to these things as well. Normocytic anemia. So anyhow, we will discuss all those things in detail in the coming lectures. Macrocytic anemia, simply guys, whenever there is macrocytic anemia, so like we check either the MCV is of course higher than 100. We check like either there is megaloblastic changes or are there, or so whenever the megaloblastic changes are there, so we call it as megaloblastic anemia. And if there is no megaloblastic changes, we call it as non-megaloblastic anemia. Uh, okay, we will discuss this megaloblastic changes or non-megaloblastic changes in detail. You can say when we are going to what you can say when we are going to study um, vitamin B12 deficiency anemia. Okay, but like just for example, I can tell you over here, like what is megaloblastic changes is there is some problem in the DNA synthesis in the cells, okay, and which we can see or which we can catch easily when we see the cells under the microscope, okay. When the DNA synthesis is not going properly in the cells, okay, so there is arrest of you can say arrest of the like the cell cycle, okay, in some stage, like to be more specific, the mitosis stage. So when the cells, they are like they are mature, we can see multiple nucleus inside the cell, which are called as megaloblastic changes, okay. So when the cell size are increased and we see these hypersegmented neutrophils, we call this thing as megaloblastic changes. But when we don't see these changes, we call it as non-megaloblastic changes. Okay, and like when we will discuss vitamin B12 deficiency anemia, I will take you in the pathophysiology of that, so that like you would understand like why, like what's wrong, and why there is megaloblastic changes in the cell. So guys, whenever there is megaloblastic type of changes are seen, never forget two important causes: vitamin B12 deficiency, as well as I just want to see look like more professional in PPTs like PowerPoint. I am trying to do uh, this one. Micro B12 or folic acid are very important. So um, folic acid, okay, folic acid. Like never forget these two causes. And by the way, there are certain drugs basically which uh, folic acid deficiency anemia or vitamin B12 deficiency anemia. Now there are certain drugs which are called as antifolate drugs. One of our very important drugs is called as methotrexate, MTX. So methotrexate is one of the drug which basically exhaust the or stop the folic acid pathway, so it also gives the megaloblastic changes anemia. So like never forget vitamin B12 and folic acid anyways. And whenever the non-megaloblastic anemia is there, like non-megaloblastic macrocytic anemia, remember the liver diseases are there, as well as alcoholism, alcoholism, alcoholism. Okay, alcoholism is there. These are the people like who drink too much alcohols. They get macrocytic anemia, non-megaloblastic type. Like we don't see those changes in their neutrophils. the hypersegmented nuclei in their neutrophils. But in megaloblastic anemia, what we see the hypersegmented nuclei in their cell. So this is how we classify. Very, very, very easy. First of all, a patient came, and I can write down the scenario over here. You can remember the things, guys. Okay, so for example, you had a patient. Okay, uh, like this is how things goes in clinic. You've got a patient, and the patient complains of shortness of breath, SOB, okay, as well as palpitations. When someone have the conscious, like they can feel their heart is beating, okay, uh, like the thumping feeling. So we call it as palpitations, and like he feel fatigued, you can say, over some period of time, and as well as on examination you found like the patient is pale, okay, and other things which you can say you found is uh, you found like they have paler on palms, okay, and you found like the capillary refilling time is increased, okay, like we press the nail of the patient, okay, and we see like how much time it takes for the blood to come back, okay, like in dehydration that one is increased mostly, but okay, you can say the nails are pale as well. Maybe you will found the pulse there is tachycardia, because if you know the physiology, the cardiac output is the stroke volume multiplied by the heart rate. So whenever there is anemia, what happens, the heart beat faster, because the heart want to keep up with the body requirement, okay, supply more and more oxygen to the body. So if the anemia is so severe, maybe there can be orthostatic hypotension, but I'm not going to write it over here. So like you found multiple things, multiple findings of anemia. And then there are some clinical features which are typical with iron deficiency, as well as typical with vitamin B12 for other causes. I'm not going in that detail right now, but simply I'm giving you the scenario that the patient have these things, and you decided that okay, let's investigate this patient more. Of course, like you take more history, you ask about any stool color change, how is his diet, and all the stuff. So when we will go in more detail, you would understand why I'm saying these things. You send the patient for CBC, and CBC comes back as HB level is decreased, as well as RBCs are decreased. So you started thinking that, of course, this is anemia. Now, what kind of anemia? What you will see, MCV. Okay, so now if the MCV is less, it is microcytic. If it is normal, it is normocytic. If it is more, then it is macrocytic. And you are going to correlate these findings with RDW. Okay, my previous lecture. So, for example, MCV comes back as low. So, okay, now you know that MCV is low. So, it means it is microcytic. And you check the MCH, mean corpuscular hemoglobin. You found that this one is low as well. So, which means like the cells have less hemoglobin. So, less hemoglobin means what? Pale cells, pale RBCs, which is, so see, this is microcytic, and this one is hypo, like the color is less hypochromic. Okay, so and now you found that MCH is there, so is less. So you said now, okay, this is microcytic hypochromic type of anemia. So what is the most common type? You started thinking about iron deficiency anemia. Okay, then what you will do, you will go for iron studies. Okay, so if the iron studies will come back as abnormal, it's done, the diagnosis is done. If iron studies will come back as normal, then we will think about other causes. The second most important cause, for example, is thalassemia. Then I will go for other studies to diagnose for thalassemia. You understand? Now, for example, if the MCV come back as normal and MCH will come back as low, so it means like it is normocytic hypochromic anemia, which means like, okay, the patient have normocytic anemia. Think about the normocytic causes. Think about if the patient is bleeding, or if there is any recent bleeds, think about simply like, then we will go for reticulocyte count. If the reticulocyte count is increased, we will think about bleeding, we will think about hemolysis. If the reticulocyte count is less, then we will think about simply we will go and see other lines of the cells. Either all the cell lines are affected, or either one cell line is affected. If the all cell lines affected, then I told you it could be aplastic anemia, it could be myelodysplastic disorders, it could be myelofibrosis, it could be tuberculosis, it could be leukemia, it could be amyloidosis, it could be XYZ, all these things. So this is like, see, I'm giving you the directions, what we think of, okay, whenever we think about anemias. So, like, as we are studying at like, hematology from clinical point of view, so on history, remember the symptoms of anemia, see, it could be fatigue, it could be headache, it could be lightheadedness, or you can say uh, um, dizziness. Okay, so the patient can present with dizziness. It could be weakness. They have shortness of breath, and sometimes the patient can have syncope as well due to less blood supply to the brain. Okay, so like look for all these features. Not all the patients have all the features, but always inquire about all the features. Okay, so of course, like whenever we ask the history, we always ask, okay, how is your diet, family history, any illnesses, any color change in stool, any drugs you are taking. For example, iron deficiency anemia is very common in females. Why? But it is more common in females than males, simply because the females, they lose a lot of blood every month by menses, or some females, they have increased menses like menorrhagia, so they lose a lot of blood. So we simply go for all these things, and whenever we investigate, whenever we do examination, we see pale. So this one is like the history things, and you can say these are the examination things. Okay, examinations, what you will do, you can check the pallor in mucous membrane, you can check the conjunctiva. Okay, for any pallor, you will check for hypotension, I told you before that. Will check the blood pressure, and then you search for the signs of other, like the causes. For example, vitamin B12 deficiency anemia, maybe you will found some neurological problem, they present like this way. In iron deficiency anemia, maybe you will find the typical features of iron deficiency anemia, like nail changes, spooning of the nails can be there, glossitis can be there, the inflammation of the tongue, cheilitis can be there, the inflammation of the sides of the mouth. And then we just simply go for investigations. Okay, we do CBC, we ask for reticulocyte count. Okay, and then we decide, like, either we have to do iron studies, vitamin B12 studies, folic acid studies, or XYZ, whatever is our differential diagnosis. So I think, like, you understand what is the story of reticulocytes. Okay, and these are immature RBCs simply. Okay, now reticulocytes count, should only be seen simply to see, like, either the body is making more RBCs or not. Okay, so this is the thing. Remember, whenever there is cytosis with anything, for example, if there is um, this one is like, you can go through these things. Again, like, this one is the introduction, which I've already given you, right? Clinical manifestations, all these things which are written over here. I already, of course, like here, too many things are written. These are the symptoms as well as signs of anemia. I think I talk about everything. Tinnitus can be there, not so important. Angina is a very important thing, especially in old people, because like, why there is angina. Angina, when you feel pain in the chest because of decreased blood supply to the heart. So when you have anemia, what will happen? That there will be less blood supply to all the body parts, even the heart. So sometimes there is onset of angina when someone have anemia. So that's why, whenever someone have angina, we always check their CBC as well. So in this one, systolic flow murmurs because of hyperdynamic circulation. Simply, they can have this thing. So of course, like all these things, we are going to discuss when we are going to discuss anemias individually. Many terms are there, guys. For example, there is a term called as whenever there is cytosis. For example, sorry. For example, if you will found a word erythrocytosis, what it means, like increased number of RBCs. Okay, increased RBCs in the body, RBCs. Okay, so anyone in like when they have increased number of RBCs, any cells, we put cytosis, erythrocytosis, increased number of RBCs. For example, there is a condition called as opposite of anemia is polycythemia. Like polycythemia is one of the cause of increased RBCs in the blood. Uh, the people who live at high altitude, they have they basically living at high altitude. One of the city in this world is called as La Paz. It's in Bolivia. It is like at too much height. So people who live there, they live under comparatively hypoxic conditions. So what happened? Because you are living in hypoxic conditions, so the body take it as it is, like your body need more RBCs. So the body started producing more and more RBCs. That's what happened when you go onto the hills, like mountains, and stay there. You live in comparatively hypoxic conditions, so your body produce more and more RBCs. So polycythemia is one of the example for that. So polycythemia is there. Then like for example, there's the RBCs are formed when erythropoietin is released from the kidneys. For example, someone have a tumor in the kidney and they are releasing more and more and more erythropoietin. So when the erythropoietin will be released more, there will be more erythropoiesis, and whenever there will be more erythropoiesis, what will happen? Like there will be formation of more RBCs. So smokers have comparatively more RBCs than non-smokers because due to smoking, there is like hypoxia or poor tissue oxygenation, and due to that, the body produce more and more RBCs comparatively. Not maybe it will not go into completely out of the definition. Other than that, smoker COPD, for example, COPD patients, when the lungs cannot maintain the oxygen in the body, what happens is the body started producing more and more RBCs, so they have this thing. So simply erythrocytosis is what you can say when there is more RBCs. So same like this, lymphocytosis, for example. And whenever you will found the word penia, for example, thrombocytopenia. So whenever there is the word penia, what it means, like decreased cell count. For example, what is thrombocytopenia? Thrombocytes are platelets. So thrombocytopenia is platelets. When the platelet count is less than 150,000 per liter, we call it as 150,000 per millimeter cube. We call it as thrombocytopenia because the thrombocytes or platelets are less. Okay, so of course there are when the platelets are less, of course how we will present, we are going to present with bleedings from the nose, from our when we brush teeth, it will come, it started coming out from our gums, called as gingival bleeding. Epistaxis will be there, bleeding after dental procedures. Okay, so this is the thing. And same like this, that there are different causes of thrombocytopenia. um, and on the other hand, if there is a word called as thrombocytosis, what it means, increased level of platelets. Like there is a condition called as essential thrombocytosis, which means like there's more and more and more platelets, and what you can say, whenever this is the condition, the patients may have what you can say hyperviscosity syndrome, in which the viscosity of the blood can be increased, and they have headaches, visual disturbances, and things like this. And of course there is clotting risk for sure because the platelets are increased. So there are many other causes of platelet increase. So pancytopenia, on the other hand, if there will be a term called as pancytopenia, I already talk about that. Pan means all, cyto means cells, penia means less. So all cells of the body is decreased. Okay. So of course, like when all the cells of the body is decreased, like the blood cells I'm talking about. So what will be the presentation? RBCs are less, anemia. WBCs less, infections. Platelets less, bleedings. So these patients will present with what? These patients will present with bleeding, a lot of infections or recurrent infections, as well as anemia. Platelets, WBCs, RBCs. Okay, so I gave the example of parvovirus B19. The people who have that parvovirus B19 infection, they may have aplastic anemia. So this is one of the condition, by the way, pancytopenia. Like we order a bone marrow biopsy. We want to see exactly what's going on inside the bone marrow, why bone marrow is not producing cells. So there can be a number of causes of pancytopenia, for example, myelofibrosis. So same like neutrophilia, neutropenia. Yes, when it comes to neutrophils, it is not called as neutrocytosis. Rather, it is called as neutrophilia. Okay, which means increased level of neutrophils. Okay. Basically, you can say more than 7,500 neutrophils per millimeter of cube. Okay. So, of course, like there are a number of causes of neutrophilia. It could be due to leukemias, like chronic myeloid leukemia. It could be due to infections. It could be due to stress. It could be due to exercise. So infection is a very important cause of neutrophilia. So infections basically give leukocytosis. So as you know, what is leukocytosis? So neutrophilia. So leukocytosis it gives. So this thing, it can increase in inflammation as well. Inflammation. Okay, and neutropenia will remain same, of course. Okay, neutropenia means what? Less level of neutrophils. So that is so. Lymphocytosis means what? Increase level or count of lymphocyte, which of course occurs in viral infections, as I told you, in tuberculosis as well. And lymphopenia means what? Decreased level of or count of lymphocyte, less than 1,000, you can say. Same thing with eosinophilia, which follows eosinophilia, which means like increased eosinophil count, or basophilia. Okay, so when it comes to lymphocytes, it's lymphocytosis. When it comes to eosinophils, neutrophils, and basophils, so it is neutrophilia, eosinophilia, as well as basophilia. Okay, so yes, one of the term which I wanted to tell you, there is a term called as agranulocytosis. Okay, what is agranulocytosis? Now, there is cytosis, okay, like this, which shows that there is increased level. But see, guys, whenever it says A, it means absence. So basically, agranulocytosis is a severe depletion of granulocytes. Okay, and what are granulocytes? Neutrophils, basophils, as well as eosinophils. So these are basically granulocytes. Okay, so basically what happens is like the granulocyte precursor, which give rise to these three cell lines. As I told you in the start of my lecture, that there are different precursor cells in the bone marrow. So these three cell lines are given, like granulocytes are the one which give rise to these three cell lines. So in bone marrow, the precursor cell which give rise to these three, which are called as granulocytes, they are the one who are depleted. So remember, guys, agranulocytosis doesn't means like these are increased. Rather, there is absence. Okay, A is there. So agranulocytosis is what? Severe depletion of granulocytes. And this happens in most of the patients who are taking some drugs like chemotherapeutic drugs and some antibiotics, like, which can produce this kind of condition. And they present with sudden fever, chills, weakness, and things like this. Okay, so um, okay, so I think we must move on to what you can say. Okay, like I like, it's my way. I always, what you can say, show you all the slide just to make sure, like, if you don't receive the slide, so you can go through this one. So that's I think that's all for now. And in my next lecture, I will start talking about microcytic anemia or iron deficiency anemia, right?